Hi everyone, very good afternoon, guys. Welcome back to the third and the last part that we have for the microbiology image based revision. And this is going to be primarily focusing on the bacteriology portion. We are very close to the Jan 20th exam, so now I feel that I should not burden you too much with MCQs that will create unnecessary anxiety, pressure amongst all of you. I want it to be very calm and a very smooth session. So I've decided that I am not going to ask you anything today. Today is not going to be a test session. Today is just going to be a listening me out session where I just want whatever I'm showing you, just I want your eyes should just go through those images once. There is no test, there is no quiz, there is nothing that I want to test you upon because I believe so close to the exam. I have that confidence that all of you know everything. So I am just going to make you revise all the images, hoping that these images will help you solve the questions, right? So we are going to start right away and without wasting any time, and quickly I'm going to make you go through some most important images of bacteriology that you have to know. So first and foremost, starting with the very famous सबसे पहले when this entire thing comes, what is the organism that is going to come to everyone's mind? I've got you a gram stain, I've got you a blood agar, and I've got you a nutrient agar. There are three agars, three things given in front of you: blood agar, nutrient agar, and yes, this is something known as Staph aureus. Very good. Actually, this was not what I wanted to ask you. That you know what is Staph aureus. My purpose was कि Staph aureus पे question कैसे आएगा. So first I'll tell you the clinical aspect of it. They will give you some kind of a food poisoning. Listen to me very carefully. ये FMG exam का सबसे favorite question है. I'll come back to this slide. Remember, when they are talking about food poisoning, they will give you an incubation period of 1 to 6 hours. Okay, if they give me an incubation period of 1 to 6 hours, which is very short incubation period, number one, you will think of Staph aureus, and number two, you will think of another bacteria, that is Bacillus cereus. How will you know which one have they asked me for? If they tell you C for C, if they give you there is consumption of Chinese fried rice, all of you are going to mark Bacillus cereus. And if they give you anything which is milk and meat, milk, poultry, meat, basically milk, meat ka history hai, you will mark Staph aureus. So when I gave you this question, I wanted to say there's a previous year question. There are 1920 students who've gone for a birthday party and they had pastries में creamy pastries में milk होता है. So after that, if they have had food poisoning within 6 hours, what will you think of? You'll think of milk, you'll think of Staph aureus. So coming back, अब क्या क्या photos था Staph aureus का? So first and foremost, I can appreciate the famous grape-like clusters. Everyone knows gram-positive grape-like clusters. After that, on blood agar, does it show you hemolysis? Yes, we can see it's showing us hemolysis on this blood agar. Look at the next picture, the nutrient agar. Nutrient agar पे कुछ golden color है. There is a golden color pigment because what does it show you? It shows us the very famous golden pigment called staphyloxanthin. I think everyone is aware of this कि जो golden color वाला pigment है उसका नाम is going to be staphyloxanthin. And finally, coming back, there is this bubbly. As soon as you see this bubbly test in the paper, what will come to your mind? Catalase positive. So yes, this is a catalase positive organism that all of you have to know. तो ये पूरा photo identify हो गया. Let's move on to the next. अब अगला क्वेश्चन क्या आएगा? So this is a classical food poisoning question that's going to come your way with all these bubbles wala test that will be there. Very good. Coming to the next one, if I show you a bacteria which is going to be present in chains, again gram positive, and it is going to be present in chains. Second point is that I can see this blood agar, but what am I seeing in this blood agar? This blood agar is showing me a lot of hemolysis, a very wide zone of hemolysis. So what is that going to be? Streptococcus pyogenes. Pyo में Y, pi में Y. Pi में Y is how you learn which kind of hemolysis. So pyogenes is going to show you a wide zone of hemolysis. क्या question आएगा? The two most expected questions in the paper, guys. One is a disease of the kidney, which is everyone is knowing, post-streptococcal glomerulonephritis. Other is a disease of the heart, which is known as rheumatic heart disease. So if they want to give me a question On PSGN, what color of urine will they give me? They will give us a cola color urine. So cola color urine ka history hoga, and then these pictures will be given. Or they will talk about rheumatic heart disease. What is the famous medicine criteria for rheumatic heart disease? It is the Jones criteria, the revised Jones criteria. So either the Jones criteria will be given or cola color urine will be given. Along with that, this organism in chains will be given and a wide zone of hemolysis. Last question jo aayega, please they will ask you in terms of antibiotics, is it bacitracin sensitive or resistant? ये एक previous year question है. Please learn streptococcus pyogenes is the way you write pyogenes. Remember it is bacitracin sensitive. Streptococcus is bacitracin sensitive. तो ये इसका clinical question हो गया. Let's move on to the next one. The next image that is given over here. What is this, guys? This is a very very famous picture, and this one picture will help you solve two organisms. तो ध्यान से देखो and then let me know. I think everyone has analyzed that this is something to do with the camp test, है ना? अच्छा, so now why did all of you only call it camp test? Why are you not calling it a reverse camp test? Because both of them look the same. So don't make that mistake. This could be a camp test also. This could be a reverse camp test also. दोनों में similar क्या होगा? You will see that this line, the horizontal line, in both of them will be labeled as what? In both of them, this horizontal line will be labeled as Streptococcus agalacti. So how will I differentiate? What have they asked me? I will look at this vertical line. If the vertical line is labeled as Staph aureus, then that is a camp test. If the vertical line is labeled as Clostridium perfringens, then that is a reverse camp test. So basically concept क्या है? For example, if I label this as Staph aureus, so you will say that okay, one line is Staph aureus, one line is agalacti. What are you wanting to diagnose in the patient? I am wanting to diagnose Streptococcus agalacti in this patient. Patient को Streptococcus agalacti है. I'm wanting to find out that. In reverse camp test, agalacti is already there. What am I trying to diagnose in the patient? Using agalacti, I am trying to diagnose Clostridium perfringens. So when I'm wanting to do the diagnosis of Clostridium perfringens, that is the reverse camp test. तो दोनों का एक एक clinical question बता दो. When I'm talking about Streptococcus agalacti, how is the patient going to come to me? It's going to be a very छोटा सा बच्चा. There's going to be some child who will come to me either with meningitis or with pneumonia. So one is going to be a meningitis history, one is a pneumonia history. I really don't focus much on the history because if I see camp test written, I know agalacti is my answer. Whereas for Clostridium perfringens, you know the very famous gas gangrene. Clostridium perfringens gas gangrene and the reverse camp test mentioned, so that is also done. So the same picture again and again, what am I telling you? Kahan focus karna hai? What is on the vertical line? What is on the vertical line? If the vertical line has Staph aureus, means I'm trying to do the diagnosis of agalacti. If the vertical line has Clostridium perfringens, I'm trying to do the diagnosis of Clostridium perfringens. Okay, moving on to the next one. You get a case of pneumonia, a classical case of pneumonia, and you see that okay, you can see this organism, ये जो दोनों lens वाला organism है and they have a capsule around it. So yes, that is going to be Streptococcus pneumonia. Very good. Streptococcus pneumonia is a capsulated organism. I can see a capsule around it. Can you tell me one test for this capsule? If I want to find out about the capsule, there's a very famous test. Okay, I decided not to ask you anything, so I'm not going to ask you. But there's a very famous test which we have for capsulated organisms, and that is the Quelang reaction. If you ask me what is Quelang, I have learned Quelang is swelling. That is rhyming चल रहा है ना. Quelang मतलब swelling or swelling means that I will add some antibodies on this capsule. I'm going to add some antibodies, capsule will swell up. There is going to be swelling of the capsule that will happen. So remember, Quelang is swelling. Easy हो जाएगा ना याद करना. Quelang is swelling. So any capsulated organism is going to show me the Quelang reaction positive. Finally, Streptococcus pneumonia ka colonies, I don't think anyone is ever going to forget. They look like the very very famous carom coin colonies. Everyone remembers your childhood and playing carom. You know how carom coins used to look like. Same way, carom coin colony, or it is also known as the Draughtsman colony. So these are the two names for strepto. So classical question क्या आएगा? Pneumonia का question होगा, and along with that, either this capsulated picture will be given or this carom coin colony will be given. So you'll have to give the diagnosis. Okay. Having said that, moving on to the next one. If you get this, now this is a little interesting because FMG exam, if you guys are going, then you know for a fact that these pictures are FMG exam favorite. So I'm going to take 1 minute extra. Okay, 1 minute extra on this slide because it's almost been 2-3 sessions that this question is coming back to back. Everyone is right. This is a case of diphtheria. तो क्या क्या पता करना है? How does a case of Corynebacterium diphtheria present to me? Now these two people are celebrities because their photos have been coming in every session. Okay. So first and foremost, यहाँ पर you're going to see a pseudomembrane. I can see a pseudomembrane where it's somewhere in the palate. कहाँ दिख रहा है? Palate है, tonsils है. So patient is going to have some respiratory difficulty. If all the tonsillar, palatal and this laryngeal system will get affected, so yeah, some respiratory difficulty will happen. So there is a pseudomembrane. Second, I can see something very famous called bull's neck. Bull's neck क्यों? Because there is lymphadenopathy that is present. These patients have very, very big lymph nodes, so they have a bull's neck, and these two are the same photos, no change, the same picture comes. That is how you describe diphtheria. You look at it under the microscope. How is it looking? Some of them are looking V, some of them are looking L shape, alag shapes. So that is known as the Chinese letter appearance. Very good. This is read to be the Chinese letter appearance. Okay, all of you are right again. Now till here everyone knows, but this is their favorite image. Of Chinese letter mein I have put a special stain. What is this special stain? This special stain is known as the Albert stain. What is the Albert stain? As I can see, so if I draw whatever is drawn, if I recreate that, तो कुछ green color का है, there is something of green color over here, and there is something which is going to be purple color over here. ऐसा कुछ दिख रहा है. What are these granules? Amazing guys. Albert stain is used for staining these granules called volutin granules. Yes, volutin granules are what? Usme kya hai? What is there? You'll say, what are these round, things that you've drawn? What is it containing? So remember, every bacteria needs energy, na? So energy stores. Volutin granules are going to be made up of energy, polymetaphosphate. Volutin granules are made up of polymetaphosphate. Simple way में याद रखना है. Phosphate क्यों चाहिए? Why do you need phosphate? You want to make ATP, ADP, all those energy things. So basically energy is present inside these volutin granules, and volutin granules ka stain that we have is the Albert stain. Now let me ask you the question that we are expecting this time, तो थोड़ा ध्यान से सुनना. You want to do the diagnosis of Corynebacterium diphtheria. What patient will be given to you? Either the membrane wala patient will be given or the bull's neck wala patient will be given. You want to do the diagnosis. If I ask you, you have the option of using two culture media. These are the two options given to you. One is said to be the Loeffler serum slope. One is LSS, Loeffler serum slope. One is potassium tellurite agar, which is going to be the best media that you will use. Pehle tell me which is the best one. So remember, the best one is going to be the potassium tellurite agar. Any reason for that? What is potassium tellurite agar? It is a selective media. Selective media are always the best to select for any growth. Selective media are the best. But Jo, this was if I had asked you which is the best media. But if I change the question and I say which media will you use for the earliest diagnosis of Corynebacterium diphtheria, that is Loeffler serum slope. Very interesting way of learning. See, the way you write Loeffler, Loeffler में कितने alphabets हैं? Loeffler has 8 alphabets, right? Okay, what kind of a media is it? It is going to be an enriched media. Enriched media is also 8 alphabets. So Loeffler having 8 alphabets, enriched having 8 alphabets, and how much time does it take to grow? Less than 8 hours. So within 8 hours, the growth is going to occur. 8 alphabets, 8 hours. Potassium tellurite agar takes 48 hours. So that is something, although it's the best, it is definitely the best, but it's taking too much of time. It's taking 48 hours. The earliest diagnosis, if I want to do, if my patient is having the membrane bana hua hai, there's too much of respiratory difficulty, I want jaldi wala diagnosis, then 8 hours mein who is going to help me? The Loeffler serum slope will help me. Easy. So question bas dhyan se padna. Earliest diagnosis has been asked to me or the best diagnosis. Okay, this is how the question for diphtheria will come. Now comes the next question. This is your clinical history, guys. You have a patient, you can see on the neck, there's a blackish lesion that is present, and there will always be a history. ऐसा lesion के साथ either they will say he is working in some animal industry, his work is that he deals with animal skin, they have to cut through animal skin, they have to package the animal skin, so some kind of animal wala history will definitely be given, because yes, this is known as bacillus anthrax. Very good, bacillus anthracis. तो पहले तो let me tell you what is this patient showing me. See, this is a very classical name, thoda sa complicated hai, but we'll simplify it. This is known as Hyde Potter's disease. Now if I dissect it, disease hai, Hyde matlab, what do you mean by Hyde? Hyde is animal skin, right? Hyde matlab animal skin. Potter kaun hai? Potter is a person who picks heavy objects, right? So if you all have seen a potter, like coolies and potters, how do they pick objects? They take all that skin and they put it where? They put it on their shoulders per, neck per. So all the animal skin ka jo bundles banega, they are going to put it on their shoulders. So the animal skin will come in contact with the neck, na? So the lesion will also happen on the neck only. So remember, potter means a person who picks the things and he's picking up animal skin. That is why this black lesion is known as malignant eschar. Now it's malignant matlab koi cancer nahi hai, malignant only because it's very dirty black looking. So this is a case of bacillus anthrax. And now what are these two pictures showing you? Bacillus anthracis shows you the very famous bamboo stick appearance. You can see it's going back to back like this, like a bamboo. So many sticks coming across, that is the bamboo stick. And what is the gelatin medium show you? You can see ulta tree. You can see an inverted fir tree, very famous inverted fir tree appearance. So these are the three pictures. They'll give you some animal skin person, they will give you inverted fir tree appearance, and they will give you the bamboo stick appearance. All these three you have to know. Let me ask you one very quick question, which is a theory question, but I'm sure you would be knowing. The same bacillus anthracis, if I ask you, what will you see on a penicillin agar? What will you see on a penicillin agar? So PE for PE. PE for PE. On penicillin agar, we see the pearls appearance. The string of pearls appearance is seen on penicillin. So like I said, PE for PE. Perfect. ये सबको पता है. Okay, coming to the next and another expected question. I've got you this. ये क्या photo दिखाया है? This is a diagrammatic photo that we have. This is a picture of spores, right? This is a picture that we have for the spores. So what do I have in spores? Tell me, what is the most common location of a spore? The most common location of a spore is subterminal, below the end, subterminal. So any spore forming formed subterminal, but I am not interested in that. They ask you end में कहाँ पर है? Where are the ones which are going to have terminal? So there's a way of learning it. Can you tell me the two organisms which have terminal spores? TE for TE, that is how we had learnt it. The ones with terminal spores are Clostridium, TE means tetani, and the other one is TE for tertium, right? So all of you, this is much expected this time, guys. TE for tetani, TE for tertium, TE for terminal. They are the ones who have a terminal spore. Up next question, all of you are right. So you're so well versed, I say everything is on your tips. You know what I'm going to ask you next. I will ask you which of them is also known as the drumstick appearance and which of them is also known as the tennis racket appearance, right? You guys have not, there's something known as mugging up and then there is something known as pura aise mind mein engrave karna, embed karna, right? Forever. You guys have engraved it in your memory. As it is, you are answering. So ye confusion jata hai, which is drumstick and which is tennis racket. So remember TER. TER wala is going to be the tennis racket. So tertium is the TER tennis racket and tetani then becomes the drumstick. So right, terminal wale ho gaye, but the most common is going to be subterminal. Remember this question. Out of these, the first organism, I've got you a picture of all of these together because this will will come as a history and very, very important. So what is it that you're seeing? What is this a case of? This is a classical case of Clostridium tetani. How did I identify? One by one, label all the pictures for me. So you will see this person he's not smiling, but all his muscles have undergone spasm. So what is the first picture? The first picture, I label it as 1. The first picture is Rhizus sardonicus. Very good. It's a very famous medicine question also. Rhizus sardonicus. Sardonicus means sarcastic smile. It looks he's smiling, but actually he's not smiling. His muscles are all contracted. Next, what is this picture number 2? What is this classical posture that you have in tetanus? Opisthotonus. Amazing. There is opisthotonus that you need to know. Perfect. Where is the spore going to be? TE for tetani. So subterminal or terminal? I can see terminal spores. I can see these round structures at the terminal. So picture number 3 is going to show me a terminal spore. Perfect. Now tell me something. Do you want to call this drumstick or tennis racket? TET hai. TER hota, I would have called it tennis racket. If it would have been tertium, tennis racket. Here it is not tertium, so I will call it a drumstick appearance. This is also sorted. अब ये दो photos बचा. Now remember, Clostridium, any kind of Clostridium, be it Clostridium tetani, Clostridium perfringens और कोई भी Clostridium लिखा होगा. Clostridium is an anaerobic organism. No oxygen needed. Whenever you are not wanting any oxygen, image number 4, whenever you are not wanting any oxygen, you use Robertson's cooked meat broth. Cooked meat broth, matlab this will be anaerobic. There is not going to be any element of oxygen involved. कोई भी anaerobic situation हो, you will mark ये broth का meat का pieces you will see. Robertson's cooked meat broth. And finally, image number 5. Tetani goes as a round and round and round like this. So this is known as swarming motility. Now all of you quickly are going to revise with me within less than a minute. कौन से organisms can show me the swarming motility? Quickly we will revise. There is a very famous mnemonic that all of you must have studied in your crash course, and that is the PVCs. Swarming matlab there will be a blood agar and something will be going round, round, round. Look at it once again. You have a blood agar and something is going in a round manner like this. So this swarming is shown by PVCs. Jaldi se let us write PVCs. C, you guys have already told me that is Clostridium tetani. Others we will write. Perfect. I can see all the amazing answers. P for Proteus. And for those who don't know, see, sometimes there will always be some question where you will feel that everyone in the class is answering and I am the one who's forgotten or has never read it. But never mind, everyone has learned if some things from different places. So my advice to you is जो नहीं पढ़ा वो अब पढ़ लो. But don't get depressed because of any of this. Okay, so P for what? P for Proteus. V for what? V for Vibrio. VP, again VP, Vibrio parahemolyticus. C for Clostridium tetani and C for Serratia, right? So yes, having said that, someone asked me in between, is Dines for Proteus, Dr. Ayushi? Yes. Proteus ke liye, if you're wanting to ask me which phenomena is seen, the phenomena is going to be the Dines phenomena. Perfectly. Good revision. So jaldi say this round swarming will be for 4 organisms, that is PVCs. So Clostridium tetani, I hope everyone will be able to identify. All photos done. Quick revision. This Rhizus sardonicus, opisthotonus, drumstick appearance, Robertson's cooked meat broth, and finally swarming. Coming to the next one. What organism is this? I have again 3 pictures. This picture has come up again. If I say this is the reverse camp test, which organism am I talking about? If it would have been camp test, it was Streptococcus aguilecti. If it is the reverse camp test, we are talking about Clostridium perfringens. Very good. All of you have done that earlier. This is Clostridium perfringens. Now, kya dikha? Jaldi se we are going to... Acha, there's one very famous mnemonic which students always tell me, which you always study for Clostridium perfringens, and that is senior NTR. Senior NTR वाला mnemonic सब लोग याद करते हैं, so we can always go ahead and study that also. So quickly let me know that yes, what is N? There is a reaction which we'll do in detail, Nagler's reaction. What is T? T is going to be target hemolysis. What is R? Obviously there is a reaction where is a reverse camp test positive. And S for क्या है? That I'll start because उसका photo नहीं है. Stormy clot formation. S for stormy clot formation. तो ये तो ऐसे याद करना है. NTR ka photos I'm going to show you. So first for Clostridium perfringens stormy clot formation. Second is going to be Nagler's reaction. What is Nagler's reaction? Have a look at this. In this Nagler's reaction, N for Nagler's reaction, you will see that I have used a medium with egg yolk. And suddenly I see that egg yolk is becoming very white. There is an opaque area. Egg yolk to transparent hota hai, but suddenly it's becoming black. It's becoming white. It's becoming opaque. Why? Because Clostridium perfringens has a toxin called alpha toxin. So remember, senior NTR. Senior NTR में stormy clot was S, N was Nagler's. Nagler's matlab I am using something with egg yolk. T for what? Target hemolysis. You can see double zone. Chota sa hemolysis and big hemolysis. Small hemolysis, big hemolysis. So there's a double zone hemolysis, that is target hemolysis. And what is R? R is going to be the reverse camp test. So कैसा question आएगा? Clostridium perfringens, we all know gas gangrene का question होगा. If I get a gas gangrene question, तो remember for gas gangrene, remember senior NTR. One last time revision. Why do I say one last time? Because I know so close to the exam, बार बार अब revise करने का time नहीं मिलेगा. So gas gangrene, senior NTR, stormy clot formation, Nagler's reaction, target hemolysis, reverse camp test. Coming to the next one, let me give you a little bit of history for this. There is a patient who's come to you with long-term usage of antibiotics. There is a long-term antibiotic usage mentioned over here, and you guys all, I'm sure you know the answer. We are talking about a case of pseudomembranous enterocolitis. Very good. Pseudomembranous enterocolitis, very commonly asked in medicine. Which is the organism that causes it? Another organism called Clostridium difficile. Clostridium difficile causes it. Pseudomembranous enterocolitis. So ye wala history is mandatory. Someone kept on having antibiotics, cephalosporins for a very long time, 2-3 months. He did not stop. What did he land up with? He landed up with this disease. Pseudomembrane. Membrane kahan bana? You can see this dirty membrane. This is the pseudomembrane that is formed on the mucosa of the intestine. Very good. It is formed on the mucosa of the intestine. ये एक question था previous year कि जो membrane है, where is it formed? On the inside or the outside? So remember, the membrane is formed on the inside part. That is the mucosal part has the membrane. Finally, they asked you, why is the mucosa having the membrane? What is this dirty yellow material? This is actually like a lava bursting. Everyone has seen in movies and so many other channels how a volcano burst is shown. So volcano eruption is something that they are going to talk about when they talk about Clostridium difficile. Yes, so please let me know the two main things. We will see number one, a pseudomembrane forming. Number two, there's a volcano like eruption that is going to occur. That is how you do the diagnosis. Moving on, coming on to the next one, I hope you guys can identify कि ये medium कौन सा है, because McConkey is written, Klebsiella is written. So what am I trying to show you? Which fermentation is shown? McConkey agar is labeled over here. Klebsiella pneumonia is labeled over here. Yes, perfect. This is for lactose fermentation. Amazing. तो McConkey agar का एक previous year question है, which is very famous. I want all of you to quickly revise with me. सबसे पहले tell me what are the two lactose fermenters that we know. Lactose fermenters are KK वाला organisms. Means E. coli is a lactose fermenter. Klebsiella is a lactose fermenter. Okay, KK organisms are coli and Klebsiella are lactose fermenters. Fine. Means everything else in this family. So if they ask you what is salmonella, is salmonella a lactose fermenter, guys? No. Now non-lactose fermenters में बाकी सब आ जाएगा. If I write salmonella, if I write shigella, if I write proteus, if I write yersinia, so everything else becomes non-lactose fermenter. But the twist in the story, who is waking up late lactose fermenter? Initially it is not, then it wakes up late. तो सो के लेट उठा, it has woken up late. It was sleeping and then it woke up late. And which organism is that? Yes, that is Shigella soni. Shigella soni kept sleeping. That is how we've learnt it. Soni, it kept on sleeping and it has woken up very late. So that is the only late lactose fermenter that you have to know. Otherwise, yaad rakho, the lactose fermenters are the K and K, that is coli and Klebsiella. Baki everything else on this planet becomes a non-lactose fermenter. And Soni was sleeping, woke up late, so that is a late lactose fermenter. Now the question that comes, what all does McConkey agar contain? What is the composition of a McConkey agar that you all have to know? So let's do a very quick analysis. It's a famous mnemonic called plant. So jaldi se batao, what is P? See, I'll give you one trick. Any agar, whether they talk about blood agar or nutrient agar or any other agar on this planet, दो चीजें तो हर agar में होगी. One is obviously agar, common sense, and the other is peptone. These two things are present in every agar of this planet, peptone and agar. What is extra? I'm wanting to test lactose fermentation, so lactose, so you will have to put in it. Next, I am trying to look for what? Color change. So you are putting an indicator. This is a question. What is the indicator that you have? तो कलर सी आई एम ऑलवेज ट्राइंग टू सी ना, देखो लैक्टोज फर्मेंट हुआ तो कौन सा कलर आया? द कलर हैज कम आउट टू बी पिंक. इफ लैक्टोज इज नॉट फर्मेंटेड द कलर इज समथिंग वेरी डल. सो कलर चेंज हो रहा है, मतलब समवन इज देयर हु इज टेलिंग मी दैट कलर चेंज. हु इज द इंडिकेटर? द इंडिकेटर इज न्यूट्रल रेड. एंड फाइनली टी फॉर व्हाट? टी इज गोइंग टू बी फॉर taurocolate. Taurocolate like sodium taurocolate. In simple words, taurocolate and all is what? Taurocolate and all is bile salts. In very simple words that I've talked about. Chalo, so quick revision. When I'm talking about McConkey, P for peptone, L for lactose, A for agar, N for neutral red, T for taurocolate. And why did I add lactose? For lactose fermentation, what color have I got? I've got a pink color. एक और medium आता है. This is also for lactose fermentation. This is also for lactose fermentation, but this is the clad media. Clad media is also for lactose fermentation, but यहाँ पर lactose fermentation has given what color? It has given a yellow color. McConkey में क्या color आया था? McConkey में you got a pink color. Clad has come for yellow color. When both of them are for lactose fermenter, तो कौन सा करेंगे? अब question क्या आएगा? What are you trying to find out? E. coli and Klebsiella. How does a patient of E. coli come? E. coli का patient आता है दो चीजों से, या तो UTI या diarrhea. As simple as that. Either the E. coli patient, let's say E. coli patient has come to you with UTI. You say, okay, if the UTI is because of E. coli, I have two things for lactose fermenter. Either I have a McConkey agar or I have a clad media. तो कौन सा वाला better है? What is your take on that? Which is better, guys? Out both of them are for lactose fermentation. This is also for lactose. This is also for lactose. But remember, clad is better over McConkey. Very famous previous year question. Clad is much better. Why? Clad is very comfortable. ऐसे याद रखो. Clad is very comfortable. What do I mean by that? Clad will allow everyone to grow. It will allow gram positive organisms also to grow. It will allow gram negative organisms also to grow. So if UTI has happened because of E. coli gram negative hai, so that will also grow. If UTI has happened because of staphylococcus, that will also grow. If UTI has happened because of candida bhi gram positive hai, that will also grow. So clad is very comfortable. Remember, clad allows everyone to grow. So we always like to work with comfortable people. So I will always work with clad over McConkey. Very famous question of previous year. Why is clad comfortable? Because it is allowing both gram positive and gram negative. Okay, moving on to the next one. Because I am talking about pictures in one go, I think this is another one. एक diarrhea से related question है. Very famous question of diarrhea that you have to know. Someone coming to you with rice water stools. Rice water stool is a very characteristic feature of what? Rice water stool coming to you as cholera. When I say cholera, I'm talking about Vibrio cholera. So Vibrio cholera के दो तीन fixed questions and nothing more than that can come. So firstly, they will give you some rice water stool history. Secondly, they will ask you what is the shape of Vibrio. So look at this picture. Vibrio is comma shape. Number 1 point, Vibrio is going to be comma shape. Next, they will ask you what kind of motility. Vibrio is like those stars, the Tutta Tara, the shooting stars, which no one can see. So it has something known as the darting or the shooting star motility. It has darting or the shooting star motility. Very famous motility. Okay, right now I told you something called swarming motility. Swarming was going round. Remember, I showed you one picture. I'll show it again. There was one swarming motility going as a round. What mnemonic did you tell me for that? For that you had told me PVCs. So swarming motility ke liye you are going to tell me PVCs. Now I'm telling you the darting or the shooting star motility. That is what you see with Vibrio. Okay, and what test comes positive with Vibrio? See, rice water तो is just like water wala, water is liquid, right? So the sample that I get is a stool sample. बिल्कुल water wala stool sample. I am going to convert it. I can convert it into a string. It is going to show me a positive string test. Second point. Third point. What is this culture media? TCBS. Even if you don't know the full form, कोई बात नहीं. TCBS. Which sugar is being fermented? अभी तक पहले I was talking about a lactose. Now I'm talking about sucrose fermentation. So remember that Vibrio cholera is a sucrose fermenter on TCBS. All the other Vibrios, जैसे कुछ लिखा होगा Vibrio parahemolyticus, Vibrio or any other Vibrio written, that is non-sucrose fermenter. So Vibrio cholera is a sucrose fermenter. If I want to test sucrose fermenter, which culture media have I used? I have used TCBS. That is, the TCBS tells me S for sucrose ferment हो रहा है. That is all the pictures that you have to know for Vibrio. Quick repeat. हिस्ट्री में हमेशा राइस वाटर डायरिया आएगा, राइस वाटर स्टूल, कॉमा शेप ऑर्गेनिज्म होगा, मूविंग वेरी वेरी क्विकली, शूटिंग स्टार, shows me a positive string test and is a sucrose fermenter on which media? On the TCBS media. Coming to the next one, they give you a case of pneumonia. So many things can be given. It can be a case of pneumonia, it can be a case of meningitis, it can be a case of UTI. So you will realize any organ can be affected. It can be very famously a patient admitted in the burns department. Very very famous patient admitted in the burns department. So burns में कौन सा infection सबसे common? The most common infection in the burns is going to burns patient is pseudomonas. So now how will I identify pneumonia, meningitis, UTI, burns? Hundreds of organisms can cause these infections. How did I say this is only Pseudomonas? Because Pseudomonas is very famous for a pigment. कौन सा वाला pigment? It is this blue green. Look at the plate. The entire culture plate has become, entire plate, diffusely, entire plate has become blue green in color. So as soon as I start seeing blue green pigment, remember this, as soon as I start seeing blue green pigment, which is also known as pyocyanin, pyocyanin, cyano means bluish greenish na, so as soon as I start seeing a blue green pigment, I know I'm dealing with pseudomonas. So whether they give me a history of pneumonia or meningitis or UTI or burns, as long as I'm seeing a blue green pigment, my answer will always be pseudomonas. Okay, coming to the next set of things, if this animal is shown to you, तो कौन सा organism is grown inside this animal? There is one particular bacteria which cannot be grown on culture media. No culture media. I won't show you any blood agar, nutrient agar. It cannot be cultured on any media. You will have to use this animal to grow it. So if you actually sit and count, तो ये कुछ ये जो lines दिख रही हैं, इनको अगर ध्यान से देखो तो 9 bands बन रहे हैं. These are 9 bands which are basically being formed all throughout. This is a 9-banded armadillo. This animal is a 9-banded armadillo, and all of you are right. This 9-banded armadillo is for lepra, matlab mycobacterium leprosy, which also tells me that mycobacterium lepra, it cannot be grown on any blood agar, chocolate agar kind of things. If I want to isolate it, I will have to use this animal, and this animal is known as the 9-banded armadillo. Okay, having said that, yeah, so there are not many animals in micro, तो एक animal है and वो 9 band, वो 9 वाला band देख के you will be able to identify. When I'm talking about mycobacteria, then I can't escape अपना famous वाला mycobacterium TB, तो we have to know. So I think some of the photos might be hiding behind me. I'll quickly hide myself for a minute. So what is this mycobacterium TB वाला thing that you have? तो सबसे पहले माइकोबैक्टीरियम टीबी मतलब दिस आई एम नॉट टॉकिंग अबाउट, ये सबको पता है. वी आर 3 days अवे फ्रॉम एग्जाम. ये एवरीवन नोज दिस इज द ZN स्टेन. इस पे ज्यादा टाइम नहीं वेस्ट करेंगे. दिस इज द ZN स्टेन फॉर टीबी. बट इफ आई वांट टू डू अ फ्लोरेसेंट स्टेन फॉर टीबी, फ्लोरेसेंट स्टेन कौन सा होता है? ऑरामीन, रोडामीन. देयर आर 2 स्टेन्स, ऑरामीन एंड रोडामीन, a fluorescent stain. See, the TB has become very very fluorescent. Okay, having said that, what is the LJ media? This also everyone knows. ये तो जल्दी बस recap हो रहा है कि what is the media that we have for TB? We use the Lowenstein-Jensen media. Question आएगा, what colonies do you have on Lowenstein-Jensen media? So look at this, the rough, buff, tough colonies. This is what you have to learn and go. Rough matlab, obviously rough is they are not going to be very shiny, they are very rough looking. Tough means you cannot remove them. Look at these colonies. You cannot remove them. They are very, very tough. They are very, very strong. And buff matlab, buff means cream color. Look at the colonies. Are they looking like shiny white? No, they are looking very off-white. They are looking very creamish in color. So remember, LJ media shows you rough, buff, tough colonies. That is how you will pick up Mycobacterium TB. I don't want to tell you the clinical profile of Mycobacterium TB. Everyone knows it very, very well, better than me. तो कोई problem नहीं है. Okay, moving on to the next one, which is again I've labeled it beforehand, or I'll ask you one thing. Which organism who comes to you with influenza shows you satellitism? जल्दी से बताओ. Influenza, satellitism, कौन सा वाला organism are we talking about? We are going to be talking about Haemophilus influenza. Haemophilus influenza shows you satellitism, very famous. So obviously there'll be some influenza wala history that will be given. And what have they done? कौन सा वाला agar लिया? No points for guessing. Red color hai, so they've taken a blood agar. In the center of the blood agar, what have they done? They have put up a Staph aureus. Why have they done that? Because you guys had told me Staph aureus is hemolytic. The first point you told me was Staph aureus is going to be hemolytic. Fine. Now having said that, if Staph aureus is hemolytic, it will break. यहाँ पर सारा red blood cells, all the blood will break. When the blood will break, what factors will come out? When the RBCs will break, very good, factor 5 and factor 10 are going to come out. The factor 5 and factor 10 are released, and that is what Haemophilus influenza was waiting for. Haemophilus influenza said, if you give me factor 5 and factor 10, I will grow. So Haemophilus influenza now starts growing in this area. Can you see these dots that are coming? Haemophilus influenza says, fine, Staph aureus is breaking the cells over here. Factor 5, factor 10 मिल रहा है, food मिल रहा है. So let me grow. Like a satellite, it's going to grow around. So simple. Why did they call it satellitism? Because if this is Staph aureus, then Haemophilus influenza says, I will only grow like a satellite around it. Like a satellite around it, I am going to grow. That is Haemophilus influenza. Please remember this. So it can cause influenza. It can very famously cause meningitis. Meningitis भी होता है इससे. तो you can either get an influenza related common cold type of a thing, or you can get something like a CSF sample because meningitis होगा. But rule क्या है? Do you ever refrigerate this sample? If you are suspecting Haemophilus influenza, please remember there should not be any refrigeration that is carried out. Very famous protocol that is followed. Never ever refrigeration is going to be seen. So satellitism, Dr. Kalyan, satellite lesions are different. You're talking about clinical aspects, but when I'm talking about satellitism, this is only for Haemophilus influenza that you're going to study satellitism. Okay, moving on to the next one. Quickly tell me the answer to whatever is shown over here. Whatever is shown over here, ये कौन सा वाला organism are they trying to tell you? What disease? I can see some black color organism. I can see some genital ulcer. I can also see some nodules. I can also see some reddish color rashes that are there. Okay, all of you are right. Anything that is spiral, and not just spiral, it is blackish color wala spiral. Blackish color wala spiral means some silver stain has been used. Black color means silver stain. Everyone remembers that basic rule. Path ho, micro ho. Blackish color organism matlab silver stain. This is a classical case of syphilis that I'm seeing. So I've got two cases. Actually, I've got primary syphilis over here and I've got secondary syphilis also over here. Primary syphilis में क्या है? Obviously, everyone knows there is a genital ulcer. Along with genital ulcer, there can be lymph node also. All of you are going to tell me, genital ulcer painful है, painless है, lymph node painful है, painless है. दोनों का बता दो. Painful, painless. What is painful, what is painless, or are both painful or are both painless? So remember, when you're talking about anything to do with syphilis, when you're talking about anything to do with syphilis, or I will from today onwards call it syphilis because everything is less. Everything is going to be painless. ठीक है? Ulcer is also painless and lymph node is also painless. याद रहेगा, simple. Syphilis is syphilis. सब कुछ painless है. That was primary syphilis. When I'm talking about secondary, so remember two matlab secondary, two, so condylometa lata. So that is how we define it. These nodules that you finally see, Condylometu latu is how I have learnt it. So remember, condylometa lata. This is what you see in which part of syphilis? You see in the 2 wala. Okay? Condylometu latu is what you see in 2 wala, secondary wala syphilis, and the same secondary syphilis also shows you this rash that is present on the palms. Okay? That is also going to show you the rash on the palms. Okay, having said that, तो इस अल्सर को क्या नाम देते हैं? Because I want to tell you one more infection, very important. STD हमेशा important है ना? तो what is this known as? Is this ulcer known as a chancre? Is this also known as a chancre, right? तो जल्दी से let me actually tell you what we studied over here was a chancre, okay? And then there is going to be something known as a chancroid, and दोनों बिल्कुल अलग है. I'll tell you how. What is it with chancre? Chancre is something which is syphilis. So syphilis is what? Painful or painless? So you said syphilis होगा, so this is a painless ulcer. This is a painless chancre. Whereas when I say chancroid, you know, where do you see croid? Croid is sounding like crying. So this patient is going to be crying with pain. Chancroid में patient is going to cry with pain because there is going to be a painful ulcer that you're going to see. And कौन सा organism कराएगा? Something to do with crying only. Haemophilus ducrei. Haemophilus ducrei will cause it. So repeating once again, when I'm talking about crying, chancroid, croid sounds like crying. So the patient is going to cry with a lot of pain. It's very, very painful. And crying wala organism causes it. That is Haemophilus ducrei causes it. Whereas when I say just chancre, इसमें कोई crying नहीं हो रहा, no crying. So everything is painless. Painless matlab syphilis. Is that okay? So there's no confusion now. Almost coming towards the end, everyone identifies this organism. Acha, before that, let me come back. I hope it is okay. This is how syphilis is going to look like. It's a silver stain. सब कुछ painless दिखा. Condylometu latu दिखा. That is in the secondary syphilis, and you see the rashes also. Okay. Having said that, coming on to another black color stain. But look at how the history will change. You'll say this is also coming all black color. तो ये भी कोई silver वाला stain होगा. But here I'm not giving you any genital ulcer and all history. Here I'm giving you history of a simple gastric lesion. It could be gastritis, it could be a gastric ulcer, it could be a gastric cancer, it could be peptic ulcer. तो जो भी है कुछ gastric history है. As soon as I say gastric, there's only one bacteria that will come to everyone's mind. Very good. That is Helicobacter pylori. Why is Helicobacter pylori looking silver? Because what is the silver stain for it? Warthin starry silver stain. Everyone knows this. This is on your fingertips by now. This is the Warthin starry silver stain. Rule is the same. Silver word आया मतलब black color. So H pylori के लिए WSSS. Warthin starry silver stain. You will always get something or the other related to stomach. या तो ulcer होगा, peptic ulcer होगा, cancer होगा, gastritis होगा. But stomach का history will always be there. Okay, last two diseases for the day and it's a wrap up. And I'll directly ask you one-liners. Fried egg appearance वाला colony किसका है? I have to make you identify this. Fried egg appearance wala colony matlab mycoplasma. So now that you have studied everything, you can see the fried egg appearance of the colony. So nothing fancy. So there are two fried eggs in microbiology that I taught you. एक fried egg appearance mycoplasma में था. एक fried egg appearance we did day before yesterday in a fungus. Which was that fungus which was showing you the fried egg appearance? That was Malassezia furfur. Malassezia furfur. So simple. M and M. Firstly, mycoplasma is going to show you fried egg appearance and Malassezia furfur will show you fried egg appearance. So ye wala done. The last one liner for the day, expected a lot in gynecology. Which disease shows you a clue cell? Last question, guys. Which disease shows you a clue cell? Yes. So clue cells wala is bacterial vaginosis. I hope everyone has guessed that. Clue cell is going to be bacterial vaginosis, and in bacterial vaginosis means I'm talking about Gardnerella vaginalis. So it is going to पहले तो clue cell. Let me tell you what is a clue cell. क्या clue मिल रहा है? This is a regular cell, and when I'm saying Gardnerella vaginalis means they have done a pap smear. तो कुछ pap smear वाला sample होगा because it has to come from the vagina or the cervix. तो pap smear का sample है. These are the cells of the cervix. Suddenly I see on the cells all those cocobacilli are stuck. All those cocobacilli dot 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 are going to be stuck. So that is going to be what? That is going to be a clue cell. So please remember, clue cells will give me a clue to which infection, Gardnerella vaginalis, that is bacterial vaginosis. I much expect this question when we are talking about gynae and pap smears. And एक कोई criteria है उसका जल्दी से नाम बता दो. What is the criteria that you have? And there's something called whiff test also. There's an AMSILS criteria. Let's not waste time. There's an AMSILS criteria which all of us know for bacterial vaginosis, and yes, that is sorted. Perfect. So obviously it was something very tough to cover, but I hope we managed to cover all the important bacteriology images that we had to cover. So yes, that part of it is sorted, and thank you so much for joining in. So this happens to be the last part of our crash course series. After this, for the next 3-4 days, I'm not going to bug you or bother you, because I want last 3-4 days with all your mental sanity. You should be studying and revising things which you know as per your whatever you feel is weak or needs more attention. You need to pay more attention to that. But that doesn't mean I won't be meeting you. I will obviously drop in somewhere in between, maybe for 5-7 minutes, because once before the exam, I think I will only feel very anxious if I don't talk to you, and I think it will be very nice if I can talk to you just for 5 minutes, just a day or two before the exam. Somewhere around 18th or 19th we'll meet, 5 minutes ke liye, very short 5 minute session, just to exchange wishes and to just wish you the best and to give you all the positivity and confidence that I can. PDF ka tension mat lena. In another 5 or 7 minutes, you'll get the PDF on the Telegram group. So now my advice is that whatever 2 sessions we had for patho and these 3 short sessions that we had for micro, agar kuch bhi samajh nahi aa raha what to study, how to study in the last 3-4 days, feeling very anxious and all, to bas isko bar bar dekh lena. That's about it. And yes, these are not the only 2 subjects you have to focus on. You have 17 other subjects other than this. So you have to go through images quickly, and by seeing images, I'm not saying pura paper images se bhara hoga, no, but by seeing images side by side, you revise so many things, na? Like you saw pictures of syphilis, you revise the theory of syphilis. So images help you revise everything in a faster manner. Photo bhi ho jata hai, theory bhi ho jata hai, right? And all of you who are writing to me कि मैम सब भूल गए, very very good sign. Trust me, I feel so nice when you say सब कुछ भूल गए. पढ़ा है तो भूल गए, नहीं पढ़ा होता तो कुछ भी नहीं भूलते. तो as simple as that. When you say भूल गए, a part of me is like ठीक है, मतलब everything is on track, everything is fine. If they've forgotten, means they have studied so much, they have studied in so much of excess, and they studied in so much of bulk कि अब something to your brain will obviously forget only out of it. But remember, right now you're feeling you've forgotten everything because you have all 19 subjects and your room and your study table is a total mess. जैसे ही एग्जाम में जाओगे ना, as soon as you go in the exam, all of that fades away. Your mind becomes like a clean slate. You get one question in front of you, and that is the beauty of the human mind, that your mind will direct you only towards that question. Syphilis का question आएगा तो only syphilis is what your mind will make you think of. Then you will not remember that have I studied parasitology, have I studied virology or not. वो कुछ याद नहीं आता. Your mind is actually going to just direct you towards only and only that question. But वो तभी possible है if you guys go in a very very systematic, calm, composed manner. अगर ऐसा anxious, panicky, and you are all throwing things here and there and falling here and there and going ऐसे mindset के साथ जाओगे तो it's going to be very difficult. Give yourself time. First 1 or 2 questions, don't think about the time limit. Let yourself settle down, let your heart rate come back to normal. Within 1 2 3 questions you will feel everything will start getting streamlined. ऐसा भी टाइम आएगा गाइस एग्जाम में जब 2-3 क्वेश्चन साथ साथ गलत हो जाएंगे. यू विल फील ये भी नहीं आता, नेक्स्ट वाला भी नहीं आता, थर्ड वाला भी नहीं आता. इट हैपेंस विद एवरीवन. रिमेंबर, इट इज अबाउट स्नैपिंग इन स्नैपिंग आउट. एक क्वेश्चन करा, उसके बाद जब नेक्स्ट क्वेश्चन पे गए, यू डोंट हैव टू थिंक अबाउट व्हाट हैपेंड इन द प्रीवियस क्वेश्चन. स्नैप आउट, भूल जाओ. आफ्टर दैट नेक्स्ट क्वेश्चन, सिर्फ 1 मिनट उस पर फोकस करो, अटेम्प्ट करो, भूल जाओ, गो ऑन टू द नेक्स्ट क्वेश्चन. यू हैव टू गो मिनट बाय मिनट. यू डोंट हैव टू स्टे इन द बैकलॉग कि अच्छा 5 क्वेश्चंस बिफोर डिड आई पुट द राइट आंसर और हैव आई फॉरगॉटन. ये सब नहीं सोचना. प्लीज रिमेंबर दैट, राइट? सो ऑलवेज यू हैव टू बी वेरी वेरी काम, वेरी कंपोज्ड. सब पढ़ा हुआ है, सब याद आएगा, अभी नहीं आएगा, never mind. Like I told you yesterday also, right now few battles you will lose, and that is fine. But it's not about who is going to win the battles, because it's about the war that you have to fight on 20th. Even if you lose a few battles along the way, it is okay, because the war you are definitely going to win. But provided you have a positive mindset and you are very calm and composed. तो अब कोई भी negativity, कोई भी negative thought मत रखो. सिर्फ have faith on yourself and have faith on your preparation, and obviously on destiny and God. That's about it, right? Okay. Next, I have a doubt coming again. Sorry, I missed that. Acute graft versus host rejection, hypersensitivity type 2. Yeah, type 2 hypersensitivity. General patho link I am going to post today because ab koi aur class nahi hai. So the only class I'll post for you guys is general patho if you want to go through it once. Um, Microbiology will I be teaching? Acha, that answer you'll get at 6 o'clock because there's a session. So yes, someone was asking me that. So answer is to yes, but yeah, you'll get a more detailed answer to that in a while. Okay, for NEET PG aspirants, there are separate marathons which are going to happen for you. These are obviously a very quick summary, but yes, closer to your exam, Jan end and in Feb, we'll have NEET PG marathons also. Meanwhile, yes, that is a batch for NEET PG students. That's a batch that is going on, which is the Rankers batch, which is a kind of a TND only that is happening. It's a TND plus the most important questions. So TND and MIQs are happening. This has already started and it's going to go almost till the end of February. So that is something you can follow. But apart from that, the YouTube sessions will definitely be ongoing. Okay. Someone's asked me whether you should do MCQs or quick revision of all subjects. Divide your day. You can do a quick revision of your notes and your theory for half a day, and then remaining half of the day you can do PYQs. When you do PYQs, you're revising your theory also alongside, right? So you can do a 60-40. 60-65% of the time you do your notes, and remaining 40-35% of the day you can do all your PYQs. Jaldi jaldi go through the questions and answers, right? How many PYQs are a must? Dr. Ankit, we have only 3-4 days left. So, abhi 5 years, if I tell you, that will come out to 10 sessions of FMG. So, humanly possible nahi hai. So, at least 3 years is what I'll advise. Minimum of 3 years, which means 6 sessions of FMG. Ideally, itna to minimum you will have to do. Right? Okay, so yes, thank you so much for joining in and all the very best. As I said, I will meet you for 5 more minutes closer to the exam just to wish you. But yeah, as for the crash courses, that's a wrap up to the sessions that we had, and I hope you guys, fingers crossed, I hope a lot of this comes in our paper also. So thank you, study well, all the very best, guys, and God bless you all.